Thanks for joining this morning. My name is Christina Young, and I will be your moderator for this event. Today's event is a State of Florida Medicare Fraud Prevention Week event. Before we get started, we have a few housekeeping rules to cover. This meeting will be recorded, as you just heard. Please remain on mute during the presentation. We are also in a public setting, so if you want to discuss anything more personal, please take down this 800 number, 800-963-5337, and they will route you to your local Shine and Senior Medicare Patrol team member. Our Q&A session will take place after our presentation, so please make sure to jot down any questions, or you can send them via chat or on the Facebook Live site. We look forward to answering your questions. So, how's everything coming along? Patty, Patricia, and Mary, all good?
All good.
All right, I'm gonna go ahead and turn the presentation over to please, everyone, welcome Ms. Jamila Griffin, Director of Elder Protection with the Department of Elder Affairs, for a few words.
Good morning, everyone. As Christina stated, my name is Jamila Griffin, and I am the Director of Elder Protection with the Florida Department of Elder Affairs. I want to thank everyone for taking the time to join us today to learn more about Medicare fraud and how to prevent, detect, and report such occurrences. Medicare fraud is indeed a significant issue, and it is crucial to raise awareness and educate individuals on how to protect and detect themselves. The efforts put forth by the area agencies on aging staff to prepare for this informative presentation are commendable. Throughout this presentation, you will learn more about various forms of Medicare fraud, including billing scams, COVID scams, and more. And not only will you learn about fraud, but you will also learn how to report. And once again, thank you for joining us, and I hope you receive valuable information today regarding Medicare fraud and how to protect yourselves from Medicare fraud. With me from the department, I have Amanda Knapp, who is our Shine trainer, Jalen Barnes, who is our Shine contract manager, and Kelsey Burney, who is our Shine information specialist. And not with us today is Quentin Ford, who is our training and research manager, and Shantae Pelham, who is our other contract manager. And that's all I have, and I'll turn it back over to Christina.
Thank you, Jamila. We're so glad to have so many people popping on. We're just excited to share our information about Medicare Fraud Prevention Week. Today, I'd also like to introduce to you a few Shine and Senior Medicare Patrol team members. Miss Camelita Aldridge from PSA 8. She is our Shine liaison with the Area Agency on Aging in Southwest Florida. PSA 6, Mr. Jay Todres, who is the SMP support specialist with the Senior Connection Center in the Tampa area. PSA 4, Ms. Carrie Ann Pedish, Shine advocate with Elder Source in the Jacksonville area. And again, my name is Christina Young, and I am the Shine Outreach and Education Specialist with Elder Options in North Central Florida and PSA 3. Our goal today is to describe to you who we are and what we are all about, what Medicare fraud is, and the actions everyone can take, common scams that are seen in the state of Florida, and what SMP helps with, and why it is so important to report if you have been a victim of Medicare fraud. The Department of Elder Affairs administers programs and services for elders through contract agreements with 11 Aging and Disability Resource Centers or area agencies on aging in Florida. These centers are independent, nonprofit organizations responsible for ensuring the availability of services to all elders in Florida. In the state of Florida, we are responsible for the following 3 grants. SHINE, which stands for Serving Health Insurance Needs of Elders, and we are your state health insurance program or the SHIP program. MIPA represents the 2 financial assistance programs that help lower the cost for Medicare beneficiaries. And SMP, or the Senior Medicare Patrol, represents and is Our mission is basically to empower and assist our Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So Medicare Fraud Prevention Week focuses on the actions everyone can take to prevent Medicare fraud, errors, and abuse. The start date is June 5 through June 11 because most people become eligible for Medicare when they turn 65 years old. Medicare fraud cost Medicare an estimated $60 billion per year. It costs Medicare beneficiaries in time, stress, their medical identities, and potentially their health. It costs families and friends and caregivers worry and lost work time when helping their loved ones recover from falling victim to Medicare fraud. Our guest speakers today will provide you with the information on how to protect, detect, and why it is important, again, to report Medicare fraud. Please remember to write down any questions and hold those questions to the end of the presentation. Tammy, over to you now.
Thank you, Christina. Good morning, everyone. As Christina stated, my name is Camelita Aldridge. I'm the SHINE SMP liaison for the Area Agency on Aging for Southwest Florida. Thank you for joining in the conversation today. This week, the Senior Medicare Patrol and representatives across the country are spreading the good news, ways in which Medicare beneficiaries, caregivers, medical professionals, and the general public can arm themselves with the tools to protect the Medicare Trust Fund. The SMP, or the Senior Medicare Patrol, is comprised of both paid staff and volunteers certified through individual contracts between the local Area Agency on Aging and the Florida Department of Elder Affairs. The federally funded program allows representatives of the program to provide education on ways to prevent, detect, and report areas of Medicare fraud or abuse. The financial loss to Medicare is estimated at $60 billion each year. This directly impacts you, the beneficiary, as well as those needing benefits in the future. Examples of fraud or abuse can be found in the following scenarios. 1, charging for services or supplies that were not provided. Misrepresenting a diagnosis, a person's identity, the service provided, or facts to justify payments from Medicare. 3, prescribing or providing excessive or unnecessary tests and services. The mission of the SMP is not only to educate Medicare beneficiaries, but to invite you, families, caregivers, professionals, and the community at large to the conversation. Here are some helpful tips to the beneficiaries. Prevent, that is to guard your Medicare ID as you would your Social Security number or credit card. To detect, practice reading your Medicare summary notices. They arrive in the mail or through email. Look for those services, products, equipments that you did not use or request. And if you find items of concern, please report. Call your local SMP if you believe that you have experienced healthcare fraud, errors, or abuse. Caregivers and families, constant queuing might be important. Help by educating yourself, your clients, or your loved ones on ways to protect, detect healthcare fraud, errors, and abuse. Remind clients to check their Medicare statements or to be on the lookout for items such as boxes with braces laying around the house that may have been shipped to the beneficiary without the doctor's approval. To healthcare professionals, you can also help by speaking with patients about healthcare related scams, such as those related to durable medical equipment, genetic testing, and even COVID schemes. Remind them that products and services should only be ordered by a medical physician they regularly see. Needed medical items should never be ordered on a commercial or off of a commercial. And to the public at large, help your older neighbors. When in public, be aware of older individuals purchasing gift cards in large amounts. And if you overhear someone talking about Medicare and it appears to be a scheme, don't be afraid to offer information on the SMP or SHINE. Encourage those you know to talk to trusted sources about their Medicare questions. The most effective way to stop fraud from occurring is to prevent it from happening in the first place. Our next speaker will share with you examples of Medicare fraud. Jay?
Yes, good morning. I am Jay Todris with Senior Medicare Patrol at PSA 6 in Tampa. Thanks, Cami, for sharing some good tips to help our beneficiaries not to become the next victim of fraud. I will be going over some of the scams that have been reported recently across our state. Cardiovascular genetic testing and COVID-19. Cardiovascular genetic testing fraud occurs when Medicare is billed for a cardio type of test or screening that was not medically necessary and or was not ordered by a beneficiary's treating physician. Here are several ways that cardiovascular genetic testing is advertised. It's advertised as cardio or cardiac genetic screening or testing. Also as comprehensive cardiovascular panels, cardiovascular disease genetic testing kits, and hereditary cardiovascular profiling. When should you report? Well, when a company offers you something that's free or at no cost to you, particularly testing, without a treating physician's order, and then they bill Medicare. You will know that. You'll know that your own personal physician has not ordered the testing, and that should be an indicator that there may be something wrong. Also, a company using telemedicine to offer testing to you over the phone, and they arrange for an unrelated physician who you do not know or a teledoc to order the tests for you. Also, Medicare is billed usually thousands of dollars for a broad range of cardiac genetic tests that you did not request or possibly even receive. Also, a company calling you stating that your doctor or cardiologist requested that you have testing done and they will send you a testing kit. It's no secret that the pandemic has fueled a range of new schemes. For instance, last summer, just months after the feds rolled out its program offering Medicare recipients up to 8 free COVID tests per month, the Federal Trade Commission, FTC, issued an alert warning how those on Medicare were being targeted by scammers using COVID tests to defraud Medicare. Now Medicare recipients are getting shipments of COVID-19 tests that they never ordered. You may have seen recent media attention on, particularly in the Tampa area, going over these scams and how prevalent it is amongst our seniors. The way that scammers were able to do this was by purchasing stolen Medicare numbers online or by contacting Medicare beneficiaries directly to gather their information by telephone using trick tactics such as Medicare is reviewing all accounts. There are times that they offered gift cards for updating your information. Kits are sent to Medicare beneficiaries, and then Medicare is billed for reimbursement. The tests are coming from numerous labs across the country, doctors' offices from out of state, and that makes it harder to investigate the unwanted shipments even more so. Some Medicare beneficiaries have been receiving shipments on a weekly basis. Some have indicated and reported up to 50 small packages containing test kits in the Tampa area. Next, Carrie Ann will go over how to report these scams and what type of data we need in order to report these fraud schemes and make these people accountable.
Thanks, Jay. Good
Thank you.
morning, everybody. Oops, I'm sorry, Jay. Good morning, everybody. I am Carrie Ann. I am the Shine Advocate for Northeast Florida, the Jacksonville area. And I get to talk to you about what happens when you report potential Medicare fraud. When an SMP counselor interviews you, he or she is going to ask you to describe what happened. We will be writing this into our computer system we use to report potential fraud. We'll need to collect your name, address, and phone number. We'll also need the name and contact information of the person who the fraud happened to, in case it's not you. For example, if maybe you're reporting on behalf of a spouse or a parent. We advise that you take a picture of the box label of the unwanted tests that show the name and address of the location and/or businesses that requested these tests on their behalf, or any paperwork if it comes with the kits. Next, we'll ask you for the Medicare number. And if you also have Medicaid, we'll ask you for the Medicaid number. If you have any other insurance, like an Advantage plan, a Part D plan, a Medigap supplement insurance, we'll need the name and those insurances and member IDs as well. When we report a doctor or a durable medical equipment company or any other entity, we will be asked to input the name of the company, address, website address, if they have one, telephone, dates of service, some of those details. A lot of this information can be found on your Medicare summary notice, your bills, or your explanation of benefits. We'll also ask you to send us a copy of your Medicare summary notice or your monthly statement from your Medicare Advantage plan that shows the potential fraud. We'll ask if you don't mind being contacted by a detective. Of course, you can say yes or no, whatever is most comfortable for you. If you say yes, it may help the detectives who create a case to convict the criminals. While it's important to let Medicare or your Medicare Advantage plan know about potential fraud, never ever, please, should you confront a doctor or company that is possibly committing the fraud. Not only could it be very dangerous to you, but it could also tip them off that someone is onto them and they could close up shop. So I hope I've given you a good idea of what to expect when you're interviewed by the SMP volunteer. And of course, everything that you discuss with an SMP volunteer is confidential. And in fact, you'll be provided with a client confidentiality agreement that says just that, and you'll have a copy then for your records. And with that, I'll turn the conversation back over to Christina, our moderator.
Thanks, everyone. Thanks, Carrie Ann. Wow, a lot of information to think about and a lot of things to process. But the best part is knowing that you have a team member available right near you to help you through if you know of somebody who has fallen victim or if you've fallen victim. So we're now at our Q&A session. Please feel free to either raise your hand or unmute, and we'll go ahead and ask questions in that capacity. Mary Miller with PSA 6 will also be monitoring the chat, and she will also jump in with a question here or there if you have any. And of course, our Facebook team members are out there monitoring, so if you have any questions, let us know. So Mary, do you have any questions right now in the chat at this time?
Well, there's a good question. What is the difference in working with Medicare versus the senior Medicare Patrol? Why wouldn't I just call Medicare to report directly?
Thanks, Mary.
That's to get us started. Mhm.
Yeah, so I'm going to defer to our team members out there that gave this presentation. Any one of our hosts, please feel free to jump in, unmute, and say and give an answer. Jay, you on? Oh, don't forget to unmute.
Sure. Thank you, Christina. Good question. There's a lot of confusion out there that seniors who have not dealt with these types of issues previously and may not know a lot about how the process works may think and be guided to the fact that they can report things to the 1-800 Medicare telephone number. The 1-800 Medicare number does take reports of many different scenarios involving Medicare. A lot of them are billing issues, which could be administrative in nature, could be clerical errors. When you see, and some of the points we've just gone over about emphasizing the need to check your Medicare summary notice or MSN. So yes, that is something that needs to be reported to 1-800 Medicare. The differentiation here is there's a separate aspect and a critical aspect, and that's the reason why Senior Medicare Patrol or SMP is here. Senior Medicare Patrol interfaces through a direct database. After collecting information and doing research, the SMP counselors will assemble information which seems to have indicators of being possibly criminal in nature. So the only way that that will move forward is to have somebody such as your SMP counselor assemble all the information. And what that encompasses is photos and the documentation, which is necessary for a criminal investigation. So if that had not been provided, particularly to Health and Human Services Office of Inspector General, who have the purview and jurisdiction over Medicare fraud, if it had not been reported to them previously, it will not go as a criminal referral unless it's reported directly to HHS OIG.
Thanks, Jay. Anybody else want to add on to Cammie or Carrie Ann?
I think Jay's response was adequate.
It's definitely interesting because I've run into quite a few of those situations where people will ask, well, why don't I just call Medicare? And one of the things I also remind them is if potentially a fraud situation does exist, you, when calling Medicare, you can also request a new Medicare or patient health identification number. So your Medicare number is your golden ticket to receiving health care. So you want to protect that Medicare number. So calling Medicare will help you get a new number, but all the rest of the steps that Jay just described is the concept of let's catch those guys that have perpetrated the potential scam, the proof, the documentation, and everything. So great. Thank you both for your feedback. Mary, any other questions now, or does anybody else have any questions out there? Go ahead.
Don't be shy. You have a good set of panelists here to ask questions to, so do speak up if you do have a question. Another good question for the panelists, what is the best phone number to call and report fraud?
I'll jump in on that one. Oh, go ahead, Cammie. I saw you unmute. Go for it.
Okay, so typically it would be best to go through the state's number, which would be 1-800-96-ELDER. I was just about to give my area's number. So it's 1-800-96-ELDER or 1-800-965-5337.
96353.
963. Thank you.
But we can send them all to you, Cammie, that's for sure.
Send them my way. We would love to have them. That's why we're here
Yeah.
We're here to serve the public, Medicare beneficiaries. This is a very serious topic, that our seniors are being defrauded through these schemes. It's very serious to the Medicare Trust Fund, because when they truly need the services, which is the other aspect of it, depending on how soon that fraud hit versus when the beneficiary actually needs the service, that's where it can become very tricky for them. So that's how important this subject is.
Exactly. I think the key that we just keep hearing is, yes, you can call Medicare. You can even report it to the Office of Inspector General, but the Senior Medicare Patrol works with both entities. And our role here is to compile it all together with you to not only protect your patient health information, but also get those potential charges, if they were fraudulent billed to your account, reversed, protecting the Medicare trust funds as well as protecting you. So that is our key thing that I really find important for everyone, is to know, yes, the Office of Inspector General has a website. You can call in and report it. You can go to Medicare and call. But working with the Senior Medicare Patrol here in the state of Florida is your SHIP program, your state health insurance program, or SHINE. And that 800 number 963-5337 is going to be your statewide elder helpline number. And they'll route you to your local PSA as you continue to learn from each of us. So Jay, go ahead.
Yeah, excellent point, Christina. But I want to just add to that an additional requirements, just so that our seniors are enlightened before they make the call, to have the mindset that should they receive that suspicious package, that they go ahead and open and find it's not something they ordered, their doctor knows nothing about it, doesn't fit them, or depending on the type of equipment or supplies that they are. Once you encounter that, it's imperative to save the box until you make the report to SMP, so that you'll have the necessary information. No matter which mode, whether you call yourself to Health and Human Services, they're going to ask the same questions as we're mentioning here. They need enough tangible information to pursue the bad guys. And that means names, addresses, phone numbers, which are contained within the box. So it's imperative to stop, hold on to the box before you make your report.
Great points. I think one of the things that I've had, I think Carrie Ann mentioned the whole concept of tracking down your own self, the information about the potential fraudsters. That is definitely something that we would prefer to help you with, as opposed to you reaching out. Yes, calling your doctor's office and saying, hey, doc, was this an oops? Was this a data entry error? Or was it something that you medically prescribed for me? And if that's a no on your end, then you know that it is fraud. And that's why it's so important to report. Mary, I'm going to ask you if there's any other questions out there right now.
Absolutely. There's another good question for any of the panelists right now. Why doesn't Medicare just stop paying these fraudulent charges?
Cammie's unmuted. Go for it, Cammie.
Mine is a very simple answer. Jay is the one that is more, he has a more rounded understanding, so he'll jump in for support here. But think about it this way. Think about the number of recipients or beneficiaries who utilize Medicare. In the state of Florida alone, over 3 million folks on Medicare or Medicare age. So think about that number just for the state of Florida. Think about how many times each person used their Medicare and how often Medicare is being billed. So that person on the back end doing those entries for the claims, they're so far removed from the beneficiary, they have no idea whether the claim is fraudulent or not. Can it be corrected? Yes. We like to say it's easier to ask for forgiveness, but it doesn't always work so easily when it comes to Medicare and you have a fraudulent claim. And one of the things I truly want to encourage beneficiaries to do, so when you discover that there is fraud on your account, it can be off-putting and sometimes very discouraging that you have become victim of a scheme. Here is why the Senior Medicare Patrol is so important. We work alongside you to help you to remove those emotions. We'll take on the emotions for you, and we can speak very directly in very professional terms that Medicare will understand, or that we have the access to certain agencies that you, the beneficiary, might not be aware of. And so this is why we encourage you to work with us help you resolve these issues. This is not just an isolated incident. It does feel that way, but it has a greater reach. I'm going to turn it over to Jay and let him add some more sense to that.
Well, that was plenty of sense, Cami. Made a lot of sense. There's one thing in particular, and I guess the original premise or the original question was, and probably in light of the magnified presence of the COVID-19 test kit saga that's being experienced even outside Florida on a national scope, it's so prevalent out there. There may be scenarios, there may be instances legitimately where COVID-19 test kits may be purchased now, bearing in mind that the public health pandemic is officially over now. The free test kits have basically ceased. So there will be legitimate scenarios where seniors will be purchasing those. If you see the signs outside some of the stores, such as Walgreens and CVS and the others, that they have the COVID-19 test kits, some of them to take home, because that's out there legitimately. I don't think, and I can't speak conclusively for Medicare itself, but I don't think they could just shut down all interactions involving COVID-19 test kits. Although that sounds like a viable solution, it may not be practical or realistic.
That is correct, Jay and Cami. One of the things that also comes to my mind is that there's a contract that our physicians and providers of service contract with Medicare for reimbursement for the services that are provided. So technically, until they have to prove medical necessity, right? If you, the person who's receiving the potential charge on your account, can say, hey, this never even occurred, or this was not medically necessary, Medicare will never know that those charges were fraudulent. So it really comes back to us kind of doing a double, triple check over those Medicare statements and EOBs to make sure there's a check and balance. You're reading over what the services that were provided, and did that get billed correctly? And if so, then you're good. And if it's not, that's where the potential problems can come into play. So great input. Thank you, everyone. Mary.
Yes, we do have 2 questions waiting. The first question, do you have a list of common questions to ask seniors to spark a conversation and find out if they are being scammed? This would be good for volunteers and family members.
That's a great question. Great question. Who's taking it on?
I can add a little bit of input and then I hope that everybody else backs me up with more ideas. Like I said before, I do the outreach, and so I'm out always doing presentations. And what really gets my attention is if I hear someone say that a beneficiary say they've had something delivered and they didn't know their doctor ordered it. And of course that gets my attention, and I follow up with them to ask more questions.
So prompting though individuals to talk about that. From my standpoint, I'm also the outreach person and an RPSA, and probably my conversation starter is, have you received one of those unsolicited phone calls? Have you received an unsolicited phone call from maybe your doctor's office? Maybe it was, you weren't even expecting a call and it said, hey, your doctor has been recently approved for these back braces. It's time for you to get approved for that. Unsolicited phone calls are calls that you're just not expecting. You weren't expecting anything from the doctor. Those are robocalls. Those are from those potential fraudsters. So that's one of the things that jumps out in my mind.
I would agree, Christina, when we're given presentations in the community, and you use an example, how many of you, just as you're sitting down to dinner, you'll get that unsolicited call? Just about everyone in the audience will say yes, they're recipients of those calls. And many of them will hang up or not engage. Few of them will say, I engaged to a certain degree and then discovered that they were asking me for information that I wasn't willing to share. And they'll mark the phone numbers and they'll block those phone numbers. But just for myself personally, on one of my cell numbers, I have blocked a particular caller multiple times. And what they do, they use a different phone number to call me the next time. So that's quite frustrating for me, who I'm approaching Medicare age, but not there yet. So I can just imagine what it would be for someone that is older than myself, getting multiple calls on a daily basis, especially when they're unwanted or unsolicited. So.
Great input. Jay, did you want to add on anything more?
No, I think you have all covered it very well. Thank you.
Yeah, there's so many things so many different types of scams that are going on and we want to live in a trusting society. So it is very difficult for us to not want to answer that phone, but I encourage everybody just to let it go to the voicemail. Then if it's a recorded information of some sort, or you recognize the voice, then it's okay to call back. But again, I'm one of those that says, forget it. Don't answer the phone. So Mary, I think you said there was another question out there.
Yes, there is. The question says, what additional agencies are involved in the investigation of Medicare fraud? FBI, local police, other federal agencies for ID fraud?
I'll take that one. Good question. Okay, so some of this gets into who you should report the alleged or potential scams. And again, we're accentuating the fact that we are here as primary to receive that information from you. As I mentioned, we interface with U.S. Department of Health and Human Services, Office of Inspector General. They have the primary jurisdiction. It's under their Code of Federal Regulations because they oversee Medicare. They handle the criminal aspects of any potential fraud. Many federal agencies are supplemented with other partner federal agencies so that when there are takedowns or potential enforcement actions, the FBI will partner with Health and Human Services to enact these raids, particularly sometimes simultaneously if there national in scope. They may hit certain residences or certain businesses at the same time throughout the country. That's where the FBI and other agencies may come in to supplement. What I wanted to accentuate also was the logical question comes in if somebody is not enlightened about Medicare itself and where it plays a role and how it plays out. Why can't we call the local police? Well, again, this is a federal crime. Okay, these are federal crimes because they're not medically necessary, not prescribed by a physician. And at the moment they start billing Medicare for goods and services not provided, that's criminal fraud at the federal level. So the local police would not get involved in that. There could be instances where the local police are also brought in as other supplemental officers on some of these raids. But basically, you report it to Senior Medicare Patrol and or Health and Human Services because we're the two entities out there to report these types of scams right up front.
Thanks, Jay. Mary?
Good questions. Keep them coming. Another one. Well, if it's not costing me any money, what does it matter?
That actually, go ahead, Cami.
I get that one all the time.
Me too.
It's free. So, and I'm not responsible for it. Well, it's free until you need the service. And that's where the issue comes in. So we've discussed primarily all of these kits that are going out for COVID-19 or let's talk about use the COVID-19 kits for an example. So many of these kits, I've gotten multiple ones from clients in my area. They were all unsolicited. One client in a recent month received unsolicited because each package came with 2 boxes. Each box had 2 kits. So over 20 COVID-19 tests that she did not order in 1 month. And there were multiple months. Each of those kits has a dollar value to them that has been billed to Medicare. So as Jay said earlier, we're getting away from that pandemic. We don't have the volume of folks being infected as we did when COVID first came out, but it's still around. So let's say a client or a beneficiary now needs to order that kit. And they go and they now present their legitimate kit to Medicare. That could be the very one that Medicare now denies to say, hey, in the month of April, you got 22 kits. How is it that you need another box of 2? So the legitimate claim is then denied, and it's on the beneficiary to now prove to Medicare that the first 22 that they received were unsolicited. So that's a small example. It might seem the genetic ones, they were billing Medicare for thousands of dollars, and the beneficiary now that wasn't ordered before, but the fraudulent one stands in its place. So that's what we're dealing with. It's when you need the actual benefit, it's not there for you because the fraudulent activity or fraudulent claim is standing in the way of your service.
Great feedback, Cami. Carrie, you want to add in?
Yeah, that is a great aspect to think of, Cami, and I don't. So thank you for mentioning that. I think of the picture of if you're not paying for it, but all of this money is going into Medicare fraud, then it affects beneficiaries' premiums. It affects copays, deductibles. That big picture, if the money was back in the budget and back in that fund, how it really could help our current beneficiaries and maybe even our future generations. And so that's one way that I look at it, of how even if they're not paying for it, they might be paying for it in their premiums.
That's a really good perspective to look at. Two different ones. One, there are charges that are going towards your Medicare account, first and foremost, your Medicare account that was not medically necessary, but it was billed to your account. So if Medicare only covers it one time, or like Cammie said, hey, one time for one of the cardiac genetic tests that Jay actually mentioned earlier, I've had several of those cases that ran all the way up to $30,000. $30,000 charge for just a little cheek swab, but it's only covered by Medicare once. And now that you're ready to have that treatment, you can't get it because Medicare is no longer going to cover it, or you'll have to pay out of pocket. So that's one scenario. That's a big scenario. And Carrie Ann gave a different scenario, and that's that concept of it. Our pot of gold. I always refer to it as my pot of gold. That's the money you and I continue to pay into the Medicare trust funds. We want those benefits to be there for us when it's time for us to use those Medicare funds. So keep those things in mind as you're considering why, well, if it's not costing me any money, what does it matter? It really does matter. In the long run, it will impact everybody down the line. So great question. Mary, any other ones?
There's a comment that was added to
Great.
this discussion. And it says, there's also the fact that someone somewhere has their Medicare number and may use it again or sell it. So
Sweet. Great addition to that comment. Jay, go for it.
Well, that lends itself to another thing that we can discuss that we try to do when we identify a potential victim and we contact them back after they reported to us. We have a checklist which we work from. So of course, administratively, we're reporting to 1-800-Medicare. We'll take care of assembling all of the fraud aspects, and we'll take care of that. For the fact, and it's good that this was brought up about the Medicare numbers. Many seniors get bogged down in who took their number. Was it this doctor's office or, the radiation place? Just had, x-rays, MRIs, CAT scans, whatever. Somebody there took it. Well, we don't know that, and we will never find that out. But the most important aspect for that is that we additionally suggest and advocate that our seniors who have become a victim here may want to reach out to one of the 3 credit reporting agencies, because what we've seen in numerous instances, if a senior's been scammed in this way, additionally, they will be scammed in other ways, such as the lottery scam and things totally unaffiliated with healthcare. But they get on, and we don't like to use, the bad guys use the word the sucker list, and we hate to say that. It's derogatory, and our seniors feel bad enough, so we don't say that. But they may want to mitigate the extent in which possibly this could cause identity theft. So they may want to explore options such as putting alerts out there if somebody tries to open a credit card in their name, or other things that may be indicators of identity theft.
Wow, great discussion, everyone. Mary, I thought I'd check in one more time, see if there's anything. How about our Facebook Live and entities out there? Anybody have any comments or questions that have popped up out there on Facebook land in live recording area? So
we're still waiting to hear from Facebook Live, but in the interim, sorry, Jay did mention the bad guys. So there is a question, how long does it take for the bad guys to get caught?
So
Christine?
that's, go ahead, Jay. I know you've got good information on this. Jay, give a little background from your end, where you were at prior to working with us.
I was with federal government, with Customs and Border Protection, nothing to do with healthcare, but the same premise of fraud. Fraud is the same thing everywhere, same key indicators and paper trails and such. So that's what I did before. Um, so
So in reference to the question, how long does it take to catch the bad guys?
so yeah.
Your thoughts?
Okay, so at the point that it's a one-way street. Okay, we're from the government and we're here to help, and they tell us the same thing. So as we report our information, that's the one-way street. We've referred it on. The most feedback we'll get is whether it's been accepted as a criminal referral. That much we know, and that's the last thing we generally hear. Possibly a year, year and a half, sometimes 2 years, depending on the scope. Could be international in nature. The bad guys could be in call centers, offshore somewhere, as well as bad guys here in the United States. It could take a couple of years. So I wouldn't not advocate people, wait around to hear and get feedback. It may not come. And then when it's totally unexpected, you may see something on the news a year from now. And then, may ring a bell for you.
Well, I have to admit, in 2019, when the latest scam and that was the genetic testing went into place, the end of 2018, November, December, and it kind of spiked. I'm happy to say that I think here in the state of Florida, we were very active in reporting the genetic testing. So for me, we were excited. I remember my boss saying, "What are you doing? Stop whatever you're doing and listen to this phone call," because on September of 2019, she said they basically have caught the bad guys. We had over $389,000 in charges that were perpetrated against our 49 beneficiaries for genetic testing. That $389,000 was linked to one entity. That entity was the biller to Medicare. And because of all of our efforts, every one of our PSAs, and this was a nationwide sting, the entity was closed. Now, the rest of the story is still out there. The rest of the story in building the case and all of the, the actual web of fingers that are involved, as Jay was saying, it could be everywhere. So building that case is ongoing, but we do know that that one company was closed. So it does happen. We celebrated, we had to celebrate with our local Shine. And believe it or not, our victims were thrilled to hear because they participated in sharing their information with us. That is what, for me, made it really exciting and happy to know that our beneficiaries saw, were able to be part of the celebration, that we were able to shut down the one entity that was billing. So it does happen. But anyways, Jay, go ahead.
So, that brings up another point that sometimes Florida DOEA, Department of Elder Affairs, our umbrella organization that oversees our program in the state of Florida, sometimes they'll get requests from the media for victims, depending on which local news program may be airing a story, so that they'll be looking for volunteers who have been victimized to come forward. And the thought is that a senior victim speaking on behalf of other seniors may be good ambassadors to get the word out to other seniors. If they hear and see a senior who's been victimized and they're told, don't pick up the phone, don't open the door, don't give out your Medicare number. It's very helpful when our seniors will come forward to be a volunteer, to tell their story in the media, and that can pass the word exponentially out there to prevent further victims.
Thanks, Jay. All right, Mary, I'm going to do one more. We have about 5 minutes left, so want to double check and make sure we got all the questions answered, and then go ahead.
There is another question. If I receive some packages, should I change my Medicare number? And if yes, how should I do it?
Who's going to answer?
I'll answer.
Go
Well,
for it.
okay, so there's several steps in the process, and the practitioners, Christina, Cami, everybody on here today who do this work every day know, and they will work with you as the senior or the victim, work with you and Medicare to discuss and report that to Medicare. The senior can request a new Medicare number. I cannot say that in each and every case it's been granted and that Medicare does it. I'm not sure exactly what the criteria is. Sometimes they'll replace the card, sometimes they won't, but we'll do everything we can to report it properly so that that step can be a viable step in protecting you and mitigating anything further being perpetrated on you.
Thanks, Jay. Okay, so let me do a recap of everything real quick. And if you have additional questions, please reach out to the Elder Helpline at 800-963-5337. The Department of Elder Affairs will receive that phone call and route you to your local planning and service area or your area agency on aging or the local ADRC. If you are interested in joining us as a volunteer with the Senior Medicare Patrol or SHINE program here in the state of Florida, you can also give that phone number a call, and we will be glad to share with you this wonderful opportunity. We love what we do. I speak for everybody, but I shouldn't, but I know I love what I do. And I appreciate the opportunity. So visit our websites at floridashine.org. Visit SMPresources.org. Those are our two main websites. But again, the Elder Helpline is 800-963-5337. And they'll route you to the local SHINE SHIP program as well as the Senior Medicare Patrol program. I'd like to say thank you to our Department of Elder Affairs team that came on board with us today. So thank you, Jalen, Kelsey, and Amanda. And I believe Jamila has already left for the day. Thank you to our host, our team members and that have given you information. So Cami, thank you again for your time. Jay, Carrie Ann, Mary Miller, wonderful to work with you from a moderator standpoint. I appreciate everybody joining today. And we look forward to seeing you at one of our upcoming events. We have multiple events going on throughout the month in your local area. So please check us out. This is a nationwide event happening all across the nation. So you will probably see radio ads, TV ads, everything going on. Everybody's talking about how to protect your Medicare number, how to help get the community talking about fraud. So thanks again for your time. We appreciate it and look forward to seeing you again soon. So moderators and everybody who was on with me at the very beginning, please stay on, and thank you again for joining. We'll see you soon.
Thanks for